Hello again, it's Dr. Elisha Van Dusen from New Hope Chiropractic with today's 3-minute health talk. Yesterday I talked about upper cross syndrome. Today I'm going to talk about lower cross syndrome and what that entails. It's basically when you have, in the lower half of the body, you have weak abdominal muscles and you have weak glute muscles on opposite sides of the body, and then you have tight iliopsoas muscles or hip flexors. Those are the muscles in front of your hips. And then also very, very tight muscles in the small of your back, small of the low back. And it's called cross syndrome because from the side, those muscles are diametrically opposed and they form a cross. So a lot of people get lower cross syndrome from doing a lot of sitting at a computer, sitting at a desk, driving. All those things lend to tight hip flexor muscles and then also tight low back muscles. And then it also leads to low back pain because the tight low back muscles jam the joints of the spine together, and as well as the discs, and create a lot of nerve stress, nerve tension. And that can be helped with chiropractic adjustments, adjusting in particular the fourth and fifth lumbar bones, the sacroiliac joints, and also the sacrum. Mobilizing those joints can enable the spine to move better and also take pressure off the nerves that control those muscles, and as a result cause them to function better. But what's also important, along with the chiropractic therapy, the adjustments, is to do some home exercises. And these home exercises are very simple to do. As one set strengthens the muscles that are typically weak, and another set of exercises stretches the muscles that are tight. So stretches for lower cross syndrome involve stretching your hip flexors. You can do that by putting one knee on the ground and then bending the other knee with that foot on the ground, and then bringing your hips, bringing the pelvis as close to the ground as possible and slightly arching the low back. And then do that 2 to 3 times and hold each stretch for about 20 to 30 seconds. And then another stretch that's important is the erector spinae stretch. That stretches the muscles that go on either side of the spine in the low back that are typically tight. And what you're going to do is you're going to get on your knees with your arms extended overhead and palms on the floor, round your back out, and then walk your fingers up while lowering your head until a stretch is felt. So again, hold this position for 20 to 30 seconds and repeat 2 to 3 times. Now, there's some good exercises to do for lower cross syndrome as well, and these build up the muscles and that are typically weak, like the abdominal muscles and then also the glute muscles. So the front bridge exercise is important for all these muscles. You basically do a planking exercise. You get into a push-up position, but you put your elbows on the ground, and then also get on your toes. And you want to hold this as long as possible. In the beginning, you may not be able to hold it very long, maybe 5 or 10 seconds, but the goal is to hold it at least a minute, and that'll build up the core muscles. Also, another good one is the bird dog exercise. So you're going to go ahead and get on your knees and your hands, and then you're going to alternately raise opposite arms and legs. And this will help strengthen the weak gluteus maximus along with the abdominal muscles. And you want to hold this position for a few seconds each time you alternate each arm and each leg on opposite sides. So these are some simple ways, besides chiropractic therapy, that you can use to decrease the symptoms associated with lower cross syndrome. And as always, if you have any questions, feel free to call us, and also check out our website at newhopechiropractic.com.